Coronaviruses are a large family of viruses which may cause illness in animals and humans. CO stands for corona, VI stands for virus, and D stands for disease. Formerly, this disease was referred to as 2019 novel coronavirus. The Covid-19 virus is a new virus linked to the same family of viruses as severe acute respiratory syndrome and some types of common cold. It affects respiratory system and may cause death. It started in Wuhan district of China in 2019. Since then, the virus has spread to nearly every country, leading the World Health Organization to declare this as a pandemic. Keep safe, keep well, and most of all, keep the faith. We will get through this together. According to WHO, common signs include fever, common flu, cough, pain in body, loss of smell and taste, sneezing and respiratory difficulties. Serious cases can lead to pneumonia, kidney failure and even death. Researchers believe that the viruses transmit via fluids in the respiratory system. COVID-19 is diagnosed with a laboratory test. Your healthcare provider may collect a sample of your saliva or swab your nose or throat to send for testing. Coronavirus spreads from person to person through close communities. When people with COVID-19 breathe out or cough, they expel tiny droplets that contain the virus. These droplets can enter the mouth or nose of someone without the virus, causing an infection to occur. The most common way that this illness spreads is through close contact with someone who has the infection. Close contact is within around 6 feet. The disease is most contagious when a person's symptoms are at their peak. However, it is possible for someone without symptoms to spread the virus. A new study suggests that 10% of infections are from people exhibiting no symptoms. Droplets containing the virus can also land on nearby surfaces or objects. Other people can pick up the virus by touching these surfaces or objects. Infection is likely if the person then touches their nose, eyes, or mouth. It is important to note that COVID-19 is new and research is still ongoing. There may also be other ways that the new coronavirus can spread. COVID-19 will reshape our world. We don't yet know when the crisis will end, but we can be sure that by the time it does, our world will look very different. According to WHO, to prevent the spread of COVID-19, following measures should be taken. Maintain a safe distance from others, at least 1 meter, even if they don't appear to be sick. Wear a mask in public, especially indoors or when physical distancing is not possible. Choose open, well-ventilated spaces over closed ones. Open a window if indoors. Clean your hands often. Use soap and water or an alcohol-based hand rub. Get vaccinated when it's your turn. Follow local guidance about vaccination. Cover your nose and mouth with your bent elbow or a tissue when you cough or sneeze. Stay home if you feel unwell. What the world needs now is solidarity. With solidarity, we can defeat the virus and build a better world. The COVID-19 pandemic has led to a dramatic loss of human life worldwide and presents an unprecedented challenge to public health, food systems, and the world of work. The economic and social disruption caused by the pandemic is devastating. Tens of millions of people are at risk of falling into extreme poverty. Economic activities will remain suspended for almost 2 years, and lockdown was faced by the people all over the world, causing financial crisis and unemployment. This pandemic has affected educational systems worldwide, leading to the near total closures of school, early childhood education, universities and colleges. Most governments decided to temporarily close educational institutions in an attempt to reduce the spread of coronavirus. Every start has an end. It is said that nothing is lost if hope remains. No doubt coronavirus has left an unforgettable impact on the lives of the people around the globe. It has taught man many lessons. The most important one is the planning of God is the final. Coronavirus has changed the course of the history of the world. It has badly affected the social and economic conditions of the globe. We should follow the SOPs and get vaccinated to avoid the disease. What seems to us as bitter trials are often blessings in disguise.